This is the embryological terminology and comparative anatomy. Ventral means anterior, towards the belly. Belly means this is the abdomen, it is called the belly. Towards the belly, it is called the anterior, it is called the ventral also. Dorsal means towards the back side, like posteriorly. Cranial or rostral means towards the superiorly, it is towards the head, it is called the cranial. And caudal means towards the tail, or it is also called the inferiorly. Some of the terminology for the limbs. Proximal means near. These are the for the limb terminology. Proximal means this is the trunk. Near to the trunk, it is called the proximal, and away from the trunk, it is called the distals. Radial border and ulnar border. There are two bones inside the forearm of the upper limb. So the radial border means outer border inside the upper limb, or it is also called the lateral border. And ulnar border, which is lies on the medial aspect, or it is the medial bone of the forearm. That's why it is called the ulnar border, or it is called the medial border, or it is also called the inner border. Same way inside the lower limb. Inside the leg, there are two bones, tibia, which is the medial bone, and fibula, which is the outer bones. So the tibial border, it is also called the inner border, it is also called the inner border, or it is also called the medial border. While the fibular border, it is also called the outer border, or it is called the lateral border. Here you can see this is the radial and ulnar border. Here you can see this is the ulna is the medial bone, while the radius is the lateral bone. That's why outer border is radial, and here you can see tibia is the medial bone and fibula it is the lateral bone. That's why fibular border it is called the outer border, while the tibial border it is called the inner border, or it is also called the medial border. Tibial border it is called the medial border, and fibular border it is called the lateral border. The pre-axial border and post-axial border, which is concerned with the embryologically, the outer border in the upper limb and inner border into the lower limb, it is the pre-axial border. Always you have to remember there is a dermatome which is start from the pre-axial border inside the upper limb. I will show you here the dermatomes which is innervated from C5 to the T1 mainly, but it is overlapped also by the C4 and T2. So always you have to remember there is a dermatomes or nerve distribution which is start from the pre-axial border and end by the post-axial border. So in upper limb, the outer border it is the pre-axial border, and inside the lower limb there is a inner border, it is the pre-axial border, while the post-axial border inside the upper limb it is the inner border, it is the post-axial border, while inside the lower limb there is a outer border, it is called the post-axial border. Flexor surface, anterior surface into the limb and the posterior surface into the lower limb, it is called the flexor surface. Flexor means there is a decrease the angle between the two surfaces, it is called the flexor surface. Here I will see this is the upper limb. This surface it is called the flexor surface inside the upper limb, and inside the lower limb the posterior surface it is called the flexor surface. Why it is called the flexor surface? Wherever there is a decrease the angle between the two joints. So wherever there is a joint reduce the angle, it is called the flexor surface. If there is an angle which is increased, like the upper limb, the posterior surface, it is called the extensor surface, while inside the anteriorly, inside the lower limb anterior surface, it is called the extensor surface. The palmar pertaining towards the palm inside the hand, and the plantar means pertaining towards the sole of foot, it is called the plantar surface. This surface which is pertaining towards the palm, it is called the palmar surface. Elevate this palm. This surface which is pertaining toward the sole side, it is called the plantar surface. So these are the two surface, palmar and plantar surface. The flexion means, here you can see this is the hip joint flexion. The anteriorly, when the leg is anteriorly, it is called the flexion. When it goes backside, it is called the extension. So approximation of the flexor surface where the angle of the joint reduce, it is called the flexion. Approximation of the extensor surface where the angle of the joint increase, opposition to the flexion, it is called the extension. Hyperextension, some of the joint increase the angle more than 180 degree, which is called the hyperextension. Term used describe the moment. Adductions means moments towards the central axis, or it is called the midlines. Abductions means moments away from the central axis or midline, it is called the opposite to the adduction, it is called the abduction. Medial rotation, inward rotation or anterior surface rotate towards the midline or central axis, it is called the medial rotation, and outward rotation or anterior surface rotate away from the central axis, it is called the outward rotations. Adduction means the hand right now upper limb shoulder, it is adducted, which is near to the trunk, that's why it is called the adduction. If I will go my shoulders away from the trunk, then it is called the abduction. If my shoulder, which is the anterior surface, anterior border, which is rotated on inner side or towards the central axis, this is the central axis or midline, so towards the central axis the rotation of the limb, it is called the inward rotation, or it is also called the medial rotation. If the anterior surface of the hand, which is rotated outer sides away from the central axis, then it is called the lateral rotation of the limb. So this is the rotations of the limbs. Supination and pronations. Rotation of the forearm laterally from the mid-prone position, so that the palm of the hand faces anteriorly. Supination, pronations, the rotation of the forearm medially from the mid-prone position, so that the palm of the hand faces posteriorly. This is the mid-prone position. My palm it is mid-prone, forearm is in mid-prone positions. The rotation of the forearm laterally. This is the lateral sides. Away from the central axis, the rotation, it is called the lateral rotation of the mid-prone position, so that the palm of the hand faces anteriorly, it is called the supination. If this is the mid-prone position, hand which is forearm which is rotated on the medial side, medially mid-prone position, so the palm of the hand faces posteriorly, this is position of the forearm, it is called the pronations. Inside the pronation and supinations, the radius which is during the pronation, which is overlap to the ulna, and during the supination both the bone are completely separated to each others. Inversion and eversions, the moment of the sole of foot in which sole facing inward or medially, it is called the inversion. When the moment in which the sole of the foot facing outward and laterally, it is called the eversion. This is the example. This is my foot right now into over the horizontal surface. If the moment of the sole of foot in which the sole faces medially towards my central line, this is my central line. So the foot which is towards the central, it is facing on the midline or medially, it is called the inversion. If my foot facing outward away from the central axis, this called the eversion of the foot. Some of the moments which is like in, out, up and down, the protrusion and retraction which is occur at the temporomandibular joint, also at the shoulder joints, elevation and depressions, these are the moments. Here you can see this is the elevation of the shoulder, this is called the depressions of the shoulder. Here the mandible which is lies into the same two lips into the same position, but the lower lip which is come outside, it is called the protraction, and if it is goes inside the back side, it is called the retractions of the moments. Some of the joint, like this is the ankle joint, we will explain the flexion and extension in different way. When my foot which is elevated in towards the leg, then it is called the dorsiflexion. When it is the foot which is goes downside, it is also called the flexion, but it is towards the surface, then it is called the plantar flexion of the ankle joint. This is the dorsiflexion and this is a plantar flexion. So some joints there is a no flexion, some joint no flexion and extension, like ankle joint. Here there is a dorsiflexion and this is the plantar flexion. So here we explain the extension and flexion in different way. The term used for the hollow organs, interior means there is a inner sides. When I will remove the skull cap and I will study inside the skull, then it is called the interior of the skull. When I will study from the outer aspect of the skull, then it is called the exterior of the skull. Some of the part of the organ which is sometimes protruded inside, then it is called the inward protrusions. When it is come outside, then it is called the outward protrusion, it is called the evaginations, and the inward protrusion, it is called the invaginations. This is the normal line. If it is goes outside, then it is called the evaginations. If it is protrude inside, then it is called the invaginations. Term used for the solid organ, superficial toward the surface and deep, it is called the inner to the surface. Here you can see this is the facial artery which is superficial to the facial muscles. Below it there is a facial muscles, and if it is different way I will explain the artery which is superficial and muscle are deep, or either muscle are deep then the artery. Terminology indicate the side. Ipsilateral means the same side. Contralateral means there is opposite sides. This terminology which is mainly used for whenever there is any damage in the brain. If there is a brain which is damaged on the right side, then sometimes depends on the level, there is a paralysis which is occur on the opposite side, that's called the contralateral. If the paralysis which is occur on the same side, then it is called the ipsilateral. Term used for the muscles, origin. This is the part of the muscles. It has a origin, belly, tendon and insertions. Origin means end of the muscles which is relatively fixed and during the contraction, and which is the nearly beginning of the muscles. Insertion, the end of the muscles which is moved during the contraction, it is called the insertion. And the two terms origin and insertion are sometimes interchangeable when the origin moves and insertion which is fixed. Belly, the fleshy and contractile part of the muscles, it is called the belly. Here you can see this is the part of the muscles which is bulky, and it is the contractile part which is become shortening of the muscles, it is called the belly. While the tendon, this is the tendon, this green color, it is the tendon of the gastrocnemius. This tendon part, it is a fibrous non-contractile part of the muscles which is not contractile part, and it does not decrease the length, and that's why it is called the tendon of the muscles. Some of the muscles of the abdomen which are flattened tendons, and it is like paper like muscles. These muscles, flattening of the muscle, it is called the aponeurosis. Here you can see this is the muscles of the abdomen, it is the external oblique. The raphe, the fibrous band made up of interdigitation fiber of the tendon or aponeurosis. It mainly form inside the midline. Unlike a ligament, it is stretchable. So the raphe, it is the interdigitations of the muscles of the both the sides. Here you can see this is the interdigitation of the external oblique muscles. Ligament are fibrous and inelastic band which connect the two segments of the joint. Here you can see these are the ligaments of the knee joint. Like this is the fibular collateral ligament, this is the tibial collateral ligament, anterocruciate ligament. So These are the ligament, means it are fibrous and inelastic band which are connect the two segments of the joint. Basically the ligament which prevent the over movement of the body. Inside the body, muscles have a different shape, flat, like mainly the example of the abdominal muscles, external oblique, internal oblique and transverse abdominis are the flat muscles. It is called the aponeurosis. Pinnate means feather-like. Here you can see this is the only feather-like muscles. Picha. So it is the unipinnate and this is the bipinnate and this is the multipinnate muscles. The sum of the muscles which is rounded in shape, it is called the circular muscles, mainly the muscles around to the any orifice like eyes, nose, mouth, anal canal. Wherever there is a orifice, the muscles which is circular and which mainly to close the orifice, these are the muscle which is circular and it is mainly surround to the opening. Quadrate muscles, some of the muscles have a four boundary. Quadrate means there are four boundary. It is like square or rectangle in shape. Some of the muscles which is fusiform, which is dilated from the middle part, and this portion which is the mainly contractile part of the muscles. So hope you enjoy some of the terminology of the general anatomy. Thank you very much.